The following dramatization presents two ill-structured scenarios. It's not intended to model, but rather to promote critical reflection and group discussion about the things family members might experience close to end of life, especially when not well informed and supported. In the following scene, a patient is in the last hours of life and dying from cancer. She is attended by her husband, who wishes to be with her until the end. He is concerned and distressed and expresses his concerns to the care team. As you watch the segment, consider the following questions. What is happening? What issues does it raise? What emotions come to your awareness? What implications does it have for how we practice?
How are you doing?
I'm okay. When she breathes like that, is she in pain?
No, this breathing is just part of the process.
Isn't there something more we could do for her? I mean, it's really hard watching her like this, and worrying she might be suffering.
Now, let's review the scenario again. Consider the following questions as you watch. What is happening? What issues does it raise? What emotions come to your awareness? What implications does it have for how we practice?
It's just not right. I mean, we treat our animals better than this. We don't let them linger and suffer like Julia's suffering. We call it being humane.
In what way do you feel Julia is suffering?
Well, you just have to look at her. I mean, she's yellow, for heaven's sakes. She's breathing funny, making wheezing sounds. She's suffering.
Alex, I understand that you think Julia is suffering. But the color of her skin is a result of her liver failing and doesn't cause her any pain. That wheezing you hear is a result of her unconscious state and the way the air is flowing over her vocal cords. The weird breathing is a sign that her body's respiratory control is being affected by the toxins in the liver.
Right, and just how do you know that?
It's part of the natural process of dying. It's the body's way of gradually shutting down systems. It's difficult for us to know if someone is actually suffering because no one has ever been able to tell us what they're experiencing. So we have to go by facial expressions and movements.
That's it. That doesn't sound very scientific to me.
Well, that may be so. But we feel that if someone is sleeping peacefully, then they are comfortable. I think that the process of dying is much like the process of being born. There's a labor beforehand, and there's no way of knowing how long that'll take.
Maybe that's so, but it's hard to just sit there and watch her slipping away like that.
I'm sure that it must be, Alex. You have a little girl, don't you?
Yeah, why?
Where is she when you're here?
Well, she's with my wife's sister sometimes, and other times she's with my mother.
Sounds like you have a supportive family.
Yeah, they've been great.
Why don't you ask them to share this vigil with you? And you go home and spend some time with your daughter. She needs you too.
I suppose. But I'm afraid that Julia will pass away when I'm not there with her. I don't want her to go away when I'm not there. I feel so guilty. There's nothing I can do, but I have to be there for her. Even if all I can do is sit by her side and wait.
Alex, there are some things you can do for her. Like keeping her lips and mouth moist, massaging her arms and legs, playing some music she likes and some other things too. Let's go and see her and I'll show you.
This segment highlights that helping families to know about the natural process of dying can help reduce fear about what is happening and address concerns about the extent of suffering experienced by their loved one. The last hours of life often follow an extended period of illness and decline. It's likely and understandable that family members may be very distressed and exhausted. Involving family in the care of their loved one is central to helping family members through the transition from life to death.